If you don't know, I'm Kim Lundin. I'm the Executive Director of the OCA. And today we are going to talk about Health Benefits 101. And I'm really excited for OCA members and fantastic people. CSNW Benefits reached out to go through this guide. It's the time of year when those of us that have employees are starting to think about our programs and updating them or creating them. So I'm really glad that Reilly and his team reached out to us. So leading this discussion today is Reilly Anderson, Benefits Advisor from CSNW Benefits. And then we have two panelists with us from the industry, Heidi Fikstad from Moss Crossing and Tom Thompson from Hotbox. And so, there is a PowerPoint. I know there's a PowerPoint, but Reilly has put together a fantastic presentation. And as we go through this today, our goal is to make it real conversational, just talk through what it means to set up a plan, and specifically what it means to set up a plan for a cannabis business. We did launch a poll right when you logged in. So if you haven't taken that, you have 30 more seconds to take it through the introductions, and then we're going to close that down. And I'm going to give Reilly a chance to take up. Ooh, one more thing before we go. Speaking of making this conversational and introduction, if you have any questions during the event, you can put them in the chat box. The chat box or the Q&A. There's two options for you at the bottom of your screen. I will be watching both of those, and I'll be butting in with your questions as they're happening in real time. So you don't need to wait for it. If something comes to mind, put it in there, and we will get your questions answered right then. Great. So Reilly, I'll let you introduce yourself at first.
Awesome. Well, thank you, Kim, and welcome everybody. Yes, health insurance and a slide deck. Sounds like a fun Wednesday afternoon, but hey, we've got an hour before that Veep debate. So at least we got something coming up here soon. But no, thank you everybody. And thank you, Heidi and Tom, for joining us today. Just real quick, talk a little bit about CSNW Benefits. We're an insurance brokerage firm here in Portland. Work with all sorts of different types of organizations with their health benefits. And so, what we are, we're really the middle person, if you will, between, organizations and then the insurance carriers. So we're going to break that down a little bit. For me personally, I've been on this consulting side for about 10 years. Native Oregonian from Brownsville, Oregon, if anyone knows where that is, the grass seed capital of the world. And for me as a, Oregonian voter, very pro Measure 91, this was fantastic for us, to be able to start working with cannabis companies. So we've been OCA members for years now, and really helped a lot of organizations, not just get their plans off the ground, but, just to help keep costs for, ongoing service. So with that, let's start here. So this is kind of what we're going to review today, just an overview of how benefits work, how you get them off the ground, step by step, but not too confusing. I've tried to make this as simple as possible. Healthcare can be very confusing. So this is, like I said, kind of a 101, strategies when we get to that point, and then, some tips and tricks along the way. So to keep this thing flowing and not too boring, I am going to include, Heidi and Tom with a lot of the, just discussion as we go through this process. So I think with that, Kim, why don't we show the survey results?
Sharing them right now. And no pressure, Heidi and Tom. You're up to us to keep us entertained is apparently what I got from the feedback. So I hope you're ready for that. I just shared them. Can everyone see them? Hopefully.
Yes. So it looks like we've got about 50% owner management. We got some HR folks, production, some affiliates, some others. From a company size standpoint, this is great. A bunch of organizations from 1 to 25, a couple in that 25 to 50 space. Oh, and look at this. Awesome. 50-50 split on if you're offering benefits now and if you aren't. The last question here, your employer offer benefits, and it's kind of the reasons why. Attraction, retention, we're going to talk about that. Wellness, tax advantages. So this is cool. So thanks for doing that, everybody. And I think what I'm going to do first before starting the boring slide deck here, I'm going to stop sharing my screen. And I'm going to open this up to just Heidi and Tom, and you guys, can take turns or one of you go. But we've helped you all, your organizations, this year, get your programs off the ground. So what was it, was it this year? Was it just maybe it felt like it was the right time for your organizations? What was it with you two just to, hey, we want to look at this for the first time?
Sure, I'll let you go, Heidi.
Thank you. I was like, I don't know. We're both so polite. With Moss, it's always been our intention. This actually isn't the first time that we've considered health benefits, but we are a single store operation. We're one retail store, and right out the gate, we just literally couldn't afford it. And then over the years, we're in our 5th year now, we realized that, hey, this might become a more realistic goal. And we started looking at maybe just offering it to upper management and our salaried employees. And our first delving into it was mostly just internet research, and it seemed so expensive. And once we got in contact with CS Northwest, talking to Reilly and Jules, actually, both of them were like, just let's have a conversation because you might be surprised. And we were surprised by the actual cost of offering health insurance to all of our full-time employees. And so COVID did play a part in the specific timing, because we did start looking into it in the spring when it hit, because it became just even more pressing and even more important. And, we jumped on offering our employees hazard pay, but we were like, really what we need is to help protect our employees' health. So diving into it with someone to actually guide us through the process was really, really helpful. And then figuring out what the actual costs were, especially given the cannabis industry in general. We have kind of a younger demographic. And so the price per employee was shocking to us. And we were really excited to be able to offer it to all of our full-time employees.
Yeah, that's really kind of echoes our story as well. I come from the healthcare industry, was my latest venture in non-cannabis businesses. And we've always wanted to offer the insurance, but similar to every other type of thing that we've tried to offer, we're very limited with the whole legality and having a cannabis company. Up until now, it was even hard for us to retain general liability insurance, let alone health insurance. And so we've just I actually started engaging CSNW in 2018 from an OCA event, and we let it fall off. And then it came back up as we really need to be doing this for our employees. And we kind of hit that threshold with the ACA that is like, if you, in the state of Oregon, if you don't get insurance, you're going to be penalized. And so our big rollout this year has just been with multiple different benefits to offer, adding the Oregon Saves, adding the CSNW. We started doing a couple other things. Same with Heidi, we did hazard pay. We gave everybody a bonus, and then we paid everybody for 2 months, $8 extra an hour. And then for the 2 months after that, $6. And we just titrated that down to now they're back to their standard pay. But luckily, CSNW was able to really step in at the last minute and help us get that insurance package started the first of this month. And same with Heidi, I was greatly surprised. I want to say my personal plan when I was on the Affordable Care Act's health insurance exchange was about $200 a month more. And the same difference is we have a bunch of, a lot of our employees are in the 21 to 30 range. And when you're in the medical field, a lot of your folks are in the 30 to 90 range. And so the risk factor grows, and so does your policy. So it's been a really pleasant process. They were very helpful for us. We rushed them, but they played right along.
There wasn't a rush. We had it. But that's a great segue. And you all mentioned, cost a lot. So let's jump into the presentation now and really talk about, the cost, how it comes about, and really just, what we're finding in the market from a cannabis demographic, where age does come into play. So let's get the screen back up. Hey, look, technology's working today. Right on.
And Reilly, just to clarify, when you say that, when we're talking about cannabis market, is it still company specific? So it will be where your company's age demographic is?
It is. Yep. Yep. Exactly. And we'll talk a little about here. And so I know this slide, everyone's eyes are glazing. Oh my gosh, there's a lot of words. Here we go. So I don't, y'all don't need to be taking notes or anything on this. We do have all this that we're going to distribute out to everybody. Kim, I know that you've got access to this. So, okay. How do you get these things off the ground? What is all this about? So in Oregon, we really have two different, kind of size groups, and it's small group and it's large group. As part of the Affordable Care Act, small group is if your organization has under 50 FTE, and that stands for full-time equivalent employees. And so an FTE is one employee that works 30 hours. So if you've got two employees that are part-time working, 15 hours, that counts as one FTE. And on the large group sides, it's the other way around. So believe it or not, I mean, we've helped organizations with 5 people, get their plans off the ground. All you really need are 2 employees enrolled, 1 W-2, outside of ownership. And so, you can't just have a family and everyone in your family, sign up. It doesn't work that way. You got to actually have a couple legit employees. So the underwriting guidelines there, for small group, we'll talk about that first. Really, its benefits must be offered, to all full-time employees or part-time, and you actually get to dictate that. As the organization, you have to pay at least 50% of the premium. We're going to talk about that here in a little bit, of the lowest cost plan. You actually offer multiple plans. So just 50%, that's your obligation, to make this compliant. You can offer more if you want, but 50%, that's the lowest amount. For some groups that are under 5 employees, we call those micro groups, and sometimes the carriers, ask for, some payroll reports. But for the most part, that's it. You get to dictate eligibility. So that full-time to part-time, you could actually go all the way down to 17 and a half, hours per week. And so if you really want to offer this to very much part-timers, you can, or up to 40 hours. It's completely up to you. You get to control that. So it's kind of nice, if you wanted to start it with maybe just, management or I don't know, owners, things like that, and they happen to be the full-time 40, you can just set that bar at 40 hours. But if you wanted to open up to more staff, you can kind of just, look to see where everyone's, running there. From an elimination period, new hires, you don't want to just offer benefits to somebody who, works there for 2 weeks and then leaves you. So, what we recommend is for new hires, as long as you work for the company for, over 60 days, that's a good time to then, offer the benefit out. So we see that kind of as a benchmark in cannabis as well. If you're in that large group category, so over 50 FTE, it's a little bit different. You actually have to offer it to everyone working 30 hours. And that's that kind of, you probably heard more about that, with the ACA, the pay or play, you have to offer benefits. If you're over that 50 FTE, and they do a look back period of the year prior. So I know this could be a little bit confusing, but so if your organizations are really starting to grow and you're getting to be over FTE, you probably need to start thinking about this a little bit, because as long as you've averaged that for 1 full calendar year, it's kind of game on, to offer it to everybody. From an eligibility, it's similar, as I mentioned, but it's not that 50% bar. You actually have to, offer the lowest cost plan. You're contributing. It can't, be a little bit less than 9.78 of the household income. So again, there's a little bit of number crunching when you get to that point, and those are all things that we assist with. So, okay, we know what we're small group, we know what we're large group, so what this graph shows is, again, the full-time equivalent, under 50, over 50. So how do these rates come about? There's really just 4 components to that. So under 50 FTE, demographics, that's your crew, that's your census, that's your, age. For the most part, it's really just age, and then where you're located. And what we find in Oregon, the rates really don't change that much in different regions. Tom's out in Ontario, Heidi's down in Eugene. We got Portland market, things just depending on the contracts with some of the hospitals, they can shift a little bit. For the most part, it's your average age. And that's really why we're seeing that the rates are pretty low, from an industry standpoint, because it's young. So that's great. It's been awesome to see these rates so low. And then the state filings. And so I'm listing just a few carriers that you probably recognize. Maybe you've been on one of these health plans, through the years. Each of the carriers, and these are this is who pays the bills, who you work with, for member claims and all that stuff. They go to the state and they say, hey, this is where we want our rates to be. And these are our plan designs, and the state approves yes or no. So that's it. So under 50, it's pretty, pretty transparent. The next two fields are experience and being able to negotiate rates. So when you get over 50 FTE, you still have the demographics, you still have the state filings, but your actual claims data matters. And so if you've got a lot of folks who, are going through some surgeries or they're going through treatment, the rates could go up, depending on those claims. The nice thing about being under 50, that does not matter. You could have actually some really sick folks, but that will not, mess with your rates at all, which is nice. And then the last component is being able to negotiate. We as consultants, we can shop the market. We could say that, hey, Regents Blue Cross is a little bit lower than Providence. We can go back and kind of, leverage rates a little bit. So we as consultants have a little bit more power. So with that, I am going to stop my share again, go back to the panel. So for Heidi and Tom, you guys provided us a census. We had your whole staff, you listed everyone on there. You weren't really sure who was going to take it or not. Once we got the numbers for you, we presented some plan designs. What was the next step for you guys when it came, going back to staff? Are you interested in this? You probably didn't want to overpromise like, hey, we're going to offer you benefits. So what did that kind of look like, after we showed you the rates, ballpark rates, and then plan designs?
Do you want to go first, Tom, this time?
Sure. Basically what we did is after we got our base rates from CSNW, we as a management team first they presented us 4 of the medals: bronze, silver, gold, platinum is how the ACA works. So we chose a plan, and obviously we wanted to have something that, the executive officers all wanted these great plans because we felt we could afford them, but we also wanted to be budget conscious of all employees. So we chose bronze, gold, and silver, the 3 bottom plans. And that, I'm sure we'll get into the differences here soon. And so then what we did is then extrapolated that into a spreadsheet and determined how much each employee portion would be. And then we sent out a survey to our employees and said, if we offered health insurance, this is our base plan, and how much premium would you be willing to pay? And or do you already have insurance because you're under 26 and still on your parents' policy? And so we had to kind of do a little bit of a demographic shift based upon the returned information of who's going to participate and who wasn't.
Yeah, we were really similar. The only thing that I would add is because we're such a small company and we only have 17 employees, including ourselves, that initial decision, we did send out a survey to our employees just deciding which plans they would be more interested in. So I can see how that would probably not be a step you want to take if you have over 50 employees, because it was kind of messy even with 17, but it gave us a really clear idea of how many employees were actually interested and then what plan they would be interested in signing up for. And then once we had those options, we did the same thing and sent out the survey to find out what people were actually going to sign up for. And the thing that actually surprised us quite a bit was that a lot of our employees, because of the ACA, have health insurance under their parents or a couple through spouses. So we were surprised at how few of our employees really needed healthcare, but the ones who needed it were very excited about it. So it was actually great on all fronts because everyone's got healthcare.
You two brought up a really good point, just about, everyone doesn't have to jump on the plan. So you may have some staff that you even know, oh yeah, I'm still covered under, my parents' plan. Maybe I'm on the Oregon Health Plan, Medicaid, something like that. So there's a little bit of a game of identifying how many participants, do want to come on because the carriers do have participation requirements. And so depending on them, it's usually between about 65 and 75%. But as long as the staff who are benefit eligible have valid waivers, they don't count against that number. So, you may see somebody, hey, this is awesome, you're offering it. I'm 25, I'm going to stay on my parents' plan for one more year. But, when I come off that, really cool, that is, now an option for me.
Just to clarify that, Reilly, what you said. So if a valid waiver, so if someone's on their parents' health plan, would that count? They wouldn't be included in that calculation?
Exactly. Yep. Parents plan if you're on a spouse or a domestic partner, or, OHP, which is Oregon Health Plan, is one we see often as well. Okay. Back to the PowerPoint. So this next slide, and it sounds like most of the folks, I'm glad we did that poll. Most folks are in that 2 to 50 space. I'm not sure if there was anyone larger, but I'm still going to touch on this because, your guys' organizations are growing. You may be there pretty soon, but everything we're talking about right now are fully insured plans. You have a set cost. You pay the carriers. They're good for one full calendar year. It's set. You don't have to worry about much. And those are fully insured plans. So in that 2 to 25 space, that's really, that's it. There are association plans, and that's something that, a goal of Kim and I is for sure, at some point to have, a cannabis association plan, for if anyone's on the call that are, they're farmers, they're cultivating, maybe they don't have a dispensary, there are some, almost farming manufacturers. I've got breweries and wineries that are a part of that we could always look into. And what that does is put your census kind of into a bigger pool, if you were to share risk. So there's some creative things we can do there. Not going to jump too much into that. When you get to the 25 to 50 space, it's still those two options, but there's something called level funding. And that's something that usually when our groups, after about a year, maybe 2 years of getting used to healthcare, we start to introduce. And that's a way that, you pay these premiums, but if you're really healthy, you may get some of that premium back. So I've got a couple groups in that 50 to actually 150 space that we're quoting that out for January 1 because they're just running so well. They're really, really healthy. And so we're looking at that. They've been on a plan for a couple years. Hey, we get it. We understand this. Let's take it to the next step. And then, 50 to 150, same 3, but then we've got self-funding captives, something called reference-based pricing. So that's when the consulting stuff really, for a lot of organizations, we're doing a lot of creative things out there. But, with cannabis, certainly if you're in that 50 to 100 space, just because we know how well, from a benchmark standpoint, the plans are running. And when I mean running, it's really just, the premium dollars going in and the claims coming out, we could do things to really cap costs. So not going to spend too much time on this. But you all both brought this up, Tom, and you're talking a little bit about, just metallics and things like that. There's never one shoe size that fits all, when it comes to health plans. And so really what we encourage, our groups to do is look at a couple, maybe even 3. And so in this example, this is what we would call maybe a base buy down and buy up scenario. So you get the numbers, you get the vibe from the staff, who's kind of interested. You really hone on that number from a budget standpoint. What can we participate as an organization? So in this scenario, let's just say, you can give everyone $400, a month. And so that's great. What that's going to get you is a traditional health plan with, $1,500 deductible, decent max out of pocket, right on. But, what if we do have some health stuff going on? We're having a baby this year. We've got that surgery, and so we have some high costs. We know that's going to come up. You can add almost like a platinum buy-up option where it's a little bit more, out of the employee's paycheck, but it's way less money when they actually, get the service. And the cool thing is that you pick a plan. For the most part, you got to roll with it for a year, but every open enrollment, leading up to, when your benefits start, you can switch between these plans, or if you've got other qualifying events. So we've got a lot of members that maybe are going to have a baby. We jump on the platinum plan. We have the kiddo. That's a qualifying event. Then we could, bounce down to another plan. On the other end, I call it affordability plans, family affordabilities. How can we stretch that $400 as far as possible? I'm a healthy person. I see a doctor maybe once a year. I just need a few prescriptions. There's a lot of plan designs that maybe aren't as rich, but they have just those core benefits included. So you're just fine. So, we really encourage, multiple plan options. And both Heidi and Tom's organizations, did something like this. And I think that we've had membership, in a lot of different plans. Anything that the panel wants to add to just, was that confusing for your staff to, to see the different plan designs?
Our staff pretty much understood, but we did offer sort of like a Q&A, like if you have questions, send them to me. I didn't always know the answers, but that was the really nice thing about working with you guys. it sounds like I know what I'm talking about. I was completely ignorant to all of this before we started this process. So if there was a question that I couldn't answer for my staff, it was really easy to just shoot it over to Reilly or Jules and get an answer like that. And so it was a really effective process to just say, hey, here's the plans. If you have any questions about anything, let me know. And then the turnaround was really quick. And so it made it pretty easy to help the employees understand things that were maybe not so obvious when given the breakdown.
Yeah, I would agree. Luckily, like I said, I came from healthcare, so a lot of the information I could explain because I was actually in the provider circle. So I was always giving the patients the bad news about how much they're paying for their procedures. And we reached out. There was a couple terms that I forgot about that we reached out, and they were really quick to let us know. But what we did that was kind of helpful, because again, we're dealing with a lot of younger population, is we created a kind of a FAQ one-pager that we handed out during the sign-up process as well. And we stole a lot of information off of the CSNW website because it's readily available. It's not a secret. It's just like, what's a deductible? What's a copay? What's co-insurance? There's a lot of weird terms in the insurance industry that most people aren't familiar with.
Yeah, this stuff's like hieroglyphics, and it's changing constantly. And so that's really, the educational component is just so important. And, and Tom, you all did something a little unique too, which I haven't talked about, is even classing out a little bit.
Mm-hmm.
So, when I was talking a little bit about, you have to pay that minimum 50%, you could class out different positions. And so if you wanted to offer, 75% to management or 100% of a certain plan, you could also do that as well, as long as you don't discriminate. You just got to keep everything the same, for everyone, and kind of define that when you're hiring, those types of positions. So there's some creative things that we can do. Folks, longevity, if they've been there a certain amount of years, things like that you can do kind of behind the scenes as well. So I'm going to transition a little bit just to technology, specifically in a remote workforce. I think with everything that's going on with COVID, I don't know exactly, what everyone's organization, certainly what we're seeing. I mean, it's tough right now. It's people are doing a lot of these Zoom presentations. They're, maybe they can't see a doctor. And so I'm just going to highlight a little bit about telehealth, from a benefit standpoint and the importance of it. It's finally technology is kind of catching up, and a lot of folks have smartphones. A lot of the demographic that we see in cannabis on the younger side, they actually understand how to use smartphones and download apps all the time. And so, being able to access doctors and things like that maybe that scared folks. Oh man, I haven't seen a doctor for a long time. Do I really want to go in and get my preventative? I mean, so many things now you can talk with someone, over a smartphone and get prescriptions. I think for Tom out in Ontario, granted that's a little rural, or the state, I know Boise's pretty close, but if someone, doesn't want to drive into Boise, to get a certain prescription or something like that, they just want to pop into the Freddy's, or Safeway in Ontario just to get those eye drops. There's a lot of really creative things that these carriers are doing. So when we did that poll, I know it was kind of 50-50 already had health coverage. Really make sure that you're talking about this stuff to your staff. Hopefully you've already done that, throughout COVID, but certainly going into fall, because there's just still so many unknowns. Online enrollment platforms, this is something as well that, we could always build out for onboarding. So we get the benefits off the ground, and then generally, we implement this, for that first true open enrollment, the second year, where we already got everyone in the system. It's really streamlined. You don't have to go through this whole process again. Hey, these are the rates. They went up a little bit just because, there were some older folks to the demographic or the other way around. So again, make sure your broker partners, they probably have this type of stuff, or explaining, just making it really easy to get everything implemented, because there is a lot of paperwork, out of the gate, but we can help with all that. So I call it just modernizing, the benefit experience. And I know this is a little bit benefit talk. It's just so important, EAP programs, we're kind of in a, mental behavioral health crisis. There's just so much going on right now. This is something else that, if you can include it in a plan, Regents Blue Cross is a popular carrier here in the state of Oregon because it's a broad network and the rates are really good, but, they actually even include EAP in their programs for counseling services. So really just make sure that, hey, it's great that I have healthcare, but, just because I didn't break my leg, there's other components of your plan from a mental and behavioral health, standpoint that can really help. So that was most of the presentation because I really just wanted to, hang out with the panel here more than anything else. But I want to, kind of go back to Heidi and Tom a little bit. Heidi, your plan's been off the ground for a couple months. Tom, this is kind of fresh. How has the response been? It sounds like there's a little bit of excitement. Hey, right on, we're getting this, from our employer group. But how has it been? Maybe Heidi, for you, for a couple months now. I mean, are folks, were they happy about it? Did they give you elbow bumps? What did it look like?
They were as excited as they could be, in 2020. I don't think anybody is really feeling super joyous about the world. But I know just with COVID and everything that's happening, I know that sense of security was really important to the ones that we offered it to. And it has been relatively easy getting everybody onto the plan. It was super simple. I anticipate that come January, it's going to be easy. We're all all online with the ease. So the online platform is super understandable. Even I can do it. So it's been great. The reception's been great. I think the one thing is the part-time employees. We're just like, I'm sorry, guys. We really want to offer it to everyone. So we still have future goals. We have goals to offer it to all of our employees. We have goals to expand and tier out some of the upper management. So we're continuing to look into the future on how to make it better and better. But right now, we and our employees are all really excited that it's being offered, because it seems like most small businesses, particularly in cannabis, because we are taxed so high, and as a retailer, we can't deduct the healthcare costs from our taxes. So I know that that's a struggle. And so I think that our employees really appreciate that we've put some effort into that, and they see that. And most of the employees for us that signed up are a little bit older. They have been with our team for quite a long time, and it just helps create more of a sense of security for us and for them. Like, we care about you, they know that, and then it also feels like that makes them feel well cared for and want to stick around. So nothing but good stuff happening so far.
Good to hear. We, like Reilly was mentioning, we just started our benefit period as the first. I pushed that from my side just because open enrollment for Affordable Care Act is also in October. So I felt that we could just play off of any advertisement, any other open enrollment. So that way it's easy for the employees to remember and be like, well, why can't we do it in October? It's like, well, our plan started on January. And so that was one thing. We picked Regions Blue Cross Blue Shield. I've dealt with them forever. They have their corporate offices in Idaho anyways. So they're one of our employers they're one of our carriers that most every employer uses. And just to touch a little bit more on the benefit levels that we chose. So not only did we choose the variable plans, we did a buy up instead of a buy down, buy up. And we're offering 50% of the bronze plan to all employees 60 days plus one the first of the month. And then as you progress in your career, not only in time frame, but also in responsibility, we have different levels. So I have one level for our bud tender staff, our general labor. I mean, it's kind of putting people in a box. And then if you're a supervisor, manager, something else, there's that next level, and then say the executives. And it's in each one of those classes, it's kind of part of your raise. Okay, we're going to make you a manager, and now so we're going to pay an extra 10% after your first year per se. And then after the second year, we bumped it up to like 75%. So we wanted to get really aggressive in retention of employees to a point to where sometimes eventually you'll be 100% covered. And then some of our employees, especially in the management staff, if you've been here for over 2 years, you're 100% vested and covered. And if you're here for 3+ years, we'll pay for your gold plan. not just your belong. So it was just kind of a way to offer benefits instead of saying, here's a check, here's something that's actually worth something. Again, as Heidi mentioned, the downside is if I was any other corporation, 100% of that would come off of my taxable income. But that's just a pure flat out expense in our industry, unfortunately. So it really is an investment in your employees, whether they see it or not. It's not like a normal corporation says, oh yeah, we'll give them this because we know we're going to get this on the back end.
The dreaded 280E, and that was something for me, I really had to learn up on that, years ago, and I know, work with cannabis organizations. It's just, there's so many things that are handcuffing y'all from a federal standpoint. So, maneuvering, around the 280, and you're right. I mean, you can't write this off as a business expense like every other organization. The employees from a payroll pre-tax standpoint, if you've got a way you can do that, from a legal compliance standpoint, right on. And, as we all advocate, for the cannabis industry, I mean, my fingers are crossed, that 280 is going to go away, at some point soon. But, I think, from an attraction and retention standpoint, as the economy changes, unemployment was pretty dang low last year, and we as consultants, what we saw in cannabis was that, hey, I'm losing folks, to other organizations, maybe not even in cannabis, but because they're offering benefits. And I think, this year, I know it's kind of a wash. It's just such a weird year in general, with what's going on in the economy. But, certainly from an attraction and retention standpoint, having benefits is going to separate your two organizations. And Heidi, I don't know if you've had any new hires, in the last 2 months, but if you have, I mean, if you've talked about benefits to them, is that something like, wow, like really? I mean, has that come up at all?
Yeah, I think our store manager is more privy to the initial excitement about that in the interviews, but we've actually onboarded 4 new employees since we launched our healthcare plan. And so one of them is coming up on their eligibility of 60 days. And they're really excited about it because it is really unique, especially for a small business in the industry. And I'm excited about it because I know, like, now I've been through that enrollment process, and I know it's not as stressful as it sounds. I was so intimidated by this whole thing, and having guides guide us through it the whole time has been extraordinarily helpful. And having the understanding, like what Tom is doing for Hotbox, like understanding that you can class out certain levels of employees, and it's just like an extra tool in the toolbox of benefits for your employees and employee retention. So yeah, we're really excited, and it is usually met with some shock, like, oh really, you offer healthcare? That's awesome. So it's exciting for everyone.
Reilly, do you have any kind of stats or any kind of non-scientific idea on the percentage rate of offering insurance in cannabis versus other industries?
Oh, it's low. I mean, but it's getting better. I mean, it really is. And it's because of companies like y'all, we've probably got maybe 15 organizations. I have a local holding company, which is a few that all, are part of one. But I mean, to see the uptick, I haven't seen the uptick like I have this summer. And that's why as so many of our other clients, nonprofits and manufacturers are having to do layoffs, like, wow, cannabis, at least from what I'm seeing, must be doing okay. Or, maybe it's just like, hey, you know what, we need to offer health benefits just because everything that's going on. But if I had a benchmark, it would be a very low percentage for the groups under 50 who don't have to offer it, right? Because again, you don't have to offer it under 50 FTE. And, I do get the ones like, oh, crap, I got to do it now. I'm over 50 FTE. And then maybe they go through the process and like, oh, you know what? This isn't that bad. And heck, everyone's so excited about this. Maybe I should have done this sooner. So, I think, y'all are just good examples for doing it. And I think that trend is going to, uptick. When the economy gets better, you have to compete, right? You have to compete in the marketplace against other organizations, not just cannabis. I mean, certainly this is going to, separate you, but, that was a long-winded question, answer to your question, Kim, but it's a very low percentage, but it's getting higher every single month. I feel like, from, just doing what y'all are doing.
Yeah, that's good to hear. I think it's important too, like as we're talking with the community, as we're talking to legislatures, businesses like Heidi and Tom's are going above and beyond really to offer like this basic, human right. And because of things like 280E, they are not able to take the same advantages that other businesses are, which I'm preaching to the choir here, but I'm glad we pointed that out. And I think more we can push that message forward that, 7-Eleven is able to deduct it and we're not, is not okay. But speaking of the industry, is there anything that folks, I feel like whenever you go to add some kind of service, you're like, is it okay? I'm cannabis. Is there any kind of like concern there for a cannabis company? Is there anything that's different other than the tax stuff?
Great question. It's taken some time, and I just focused on medical benefits, but, dental, green light, with most of the carriers. Where things get a little tricky are, the life insurance and the disability, and we do have, carriers in Oregon that can write that, but a lot of the headquarters of Lincoln Financial, Mutual of Omaha, they're in red states, and they just, hey, no, we're not doing that. And so there's actually still a lot of the traditional carriers that we see in the market that do the ancillary benefits don't allow. But luckily, we found answers for that. So as kind of the pyramid of benefits, start with the health benefit program, right? Get that off the ground. And then, we always kind of show other benefits, year two. What does life insurance? Hey, pretty cool. Now we can give everyone, $10,000 of life insurance. And again, I think when you see what that cost is, it's pretty minimal, and we call it kind of, highly perceived benefits that are a low cost to the organization. But for that employee, maybe having, a disability income insurance is more impactful than even the healthcare. So we can totally do things like that. The flex spending accounts, you've probably been in organizations that have FSAs, dependent daycare. We've got a solution for that. We've identified a few that are, hey, ready to go. They're not afraid of cannabis. So we've got that. The one that does kind of suck right now are the high deductible health plans with the HSAs. And that's really because of the banking component. I know I'm dropping a lot of, acronyms here, but health savings account is a really cool strategy that we do with a lot of organizations. But some of the TPAs that we're using are looking into it just because of the growth of the industry. So hopefully that's a barrier that we're going to break down once the banks, open up a little bit more, to cannabis.
Yeah, I think just to add on that, I think that was our initial kind of why we held back is, like I said, we've had so much trouble with just general liability and workers' compensation coverage. Just because we're in Ontario, so you might as well consider us being Idaho. We're a very red state over here. So we're the liberalist company in the area, if you will. And so, it's like, we're having so much trouble with this. I don't even have time to try to figure out how we can get health coverage in an Ontario company when 50+% of my employees live in Idaho. So now you're covering two different states on a healthcare plan. And for people who don't understand the healthcare industry, usually when you cross borders, the coverage is totally different. Mm-hmm. So that was really nice to be able to work with the group to just really nail it down. And they set our mind at ease saying, yeah, no, we can do this. We'll do the Blue Cross Blue Shield. It comes across the border, and everything will be set. And just having them help us walk through the process, just because if you think about it, like even some of the insurance brokers here in Ontario won't even talk to me about property coverage for my non-cannabis business just because they know we also own a cannabis business. So having a broker service, that's not really what they're called, but having, somebody that can help us guide us through the process that is willing to work with cannabis companies is, just a really big plus in my book, because they're there fighting for us rather than me trying to fight Blue Cross Blue Shield direct.
Okay, were there any questions? I fly through these things and then I get distracted if I try to read some of the questions, but were there any good questions from the participants, or are those who are still on, if there's anything maybe you want to chat and we can answer?
Yeah, if anyone wants to plug something in the chat box and then we'll all see it, or if you want to, if it's be anonymous, you can put it in the Q&A box there. And maybe we'll give folks just a little bit longer to plug that in. While they're doing that, was wondering about alternative medicines in health plans? Is that an add-on to, like, if you wanted to offer acupuncture, that kind of thing?
Absolutely.
Yeah.
Absolutely. And both the programs with Heidi and Tom have that. And so acupuncture, the cool thing about naturopathic medicine in the state of Oregon, which is different, Tom just mentioned the differences when you jump the border, is that naturopaths in Oregon are considered primary care physicians. So, a lot of times, back in the day, if you really wanted to see a naturopath, either it wasn't covered or it would take out of maybe that allotment of funds for your alternative care. So naturopaths, you're good to go. I mean, if I take my consulting hat off, I see a naturopath, I just like that route, of medicine for me personally. And then with the chiro and acupuncture, absolutely. So if it's not embedded in the plan designs, and these are all things that we review, with y'all, usually they're really small, inexpensive riders, that we can add. Massage therapy is one that we always still get asked about, but there's one carrier in our market, Kaiser, and Kaiser is really just for folks, kind of Portland Metro, Southwest. They're starting to get a presence in Eugene, but really it's just to Salem. They do, massage therapy with no questions asked. It doesn't have to be, medically necessary, but that it's almost a no-brainer, to add those things. Because again, you may have a really healthy employee, but they just love acupuncture, right on, feels good, do it a couple times a month. And that's absolutely covered with a very, very, robust network of wellness centers.
That's great. And you said the naturopath is automatically in your plan, so you don't even need to add it on. You can just,
it's just treated just like a primary care physician. And Oregon's unique with that. I couldn't tell you, what every state. I'm sure California, Washington, it's taken a while, to even get to that point. But Oregon's one of the first states just to say no. I mean, naturopaths are, as long as you or a true doctor behind the scenes somewhere there, as long as that naturopath, has the credentials, they can write prescriptions, they can tell you, they can write you a script that you can then go and get that prescription, just like your primary care.
Speaking of crossing borders, we have a couple members, I think there might be one or two on here who are multi-state operators, not like Tom, unintentionally multi-state maybe. But
at least for the cannabis industry.
So they have like Washington and Oregon. Is that just two separate processes for folks, or is it all at once?
It's all about the company headquarters, and that's where Tom scored. Because the headquarters is in Ontario. So as long as the headquarters is in the state, you could have out-of-state folks. Yeah, we've got a lot of clients that live in New York, live in the Midwest, and so no, it's the same rates. Some carriers, and really when I'm bringing up Kaiser, and I don't want to get too nitty-gritty into that, where it's an HMO model. You have to do different plan designs, but a lot of the big players in our state, like the Regis Blue Crosses, the UHCs, they have very broad national networks. So as long as the headquarters is in Oregon. Sometimes carriers make a squeal if a majority of the staff are someplace else, but a lot of the ones we work don't. They're going to look at that just as long as the headquarters is in Oregon.
Oh, that's great. It's good to know. So we talked about the timing of this. What are folks looking at if they want to get something set up for 2021? Do they need to jump on the internet right after this call, or what are they looking at?
If you really want to look into it, you engage, certainly start with that member level census. And that's something that we could provide everybody. Or if you're working with a broker already, this isn't a CSNW commercial, you just got to get that, get the census out to shop the market. So all the 2021 rates are out. And so, if you don't have coverage, it takes longer, because it's the education, it's, the virtual environment, doing a lot of, presentations with leadership like Tom and Heidi, just say, hey, this is what we think, looks good. Then, okay, now we got to do a survey. So is there time? Absolutely. The dates to get the paperwork in is the 15th of the month prior. So to get everything in, the enrollment forms, all that stuff, you would really need to get that in, by December 15th to make a smooth implementation where everything's ready to go January 1. Member ID cards in everyone's hands, things like that. So, no, plenty of time. If you really wanted to rush a 12-1 effective, we could probably even do that. But, January 1st is a good start date. A lot of organizations do it then. So, yeah, the timing's right now. So if you just even want to get an idea of what the rates are just to help budget. You don't have to start at January 1. Moss Crossing was 8.1, Hotbox was 10.1. You can get an idea of what the rates look like, budget a little bit, and then maybe even, get it off the ground later in the year if you want to.
Yeah, like I said, I felt like we rushed them a bit, but I think we implemented ours in 2 months. It just takes a lot of you have to get after it. I'll tell you that. So that's what I would suggest too, is if you want to do it, is make sure you budget at least 90 days, just because it does take a lot of data and just communicating with your staff and getting that rolled out.
And go ahead.
Just as the smaller company, like if you thought 2 months was rushing them, I think that we started our talks maybe 6 weeks before we actually ended up getting all of our paperwork in. So if you have, I think because we have less employees, so just for the smaller companies out there, I think, now is the time to start looking into it so you don't feel as rushed. Yep. If you're feeling some sort of sense of urgency, it can happen faster than you would think.
And I guess one thing to chat about too that we didn't cover, and I knew we could do it because of past, we have joint ownerships in all of our corporations. So we were able to merge all of our corporations into a central plan. So we actually have 61 total employees amongst 3 corporations, but because they're all common ownership, we were able to get all that data and put it into one plan. So our rating was also affected beneficially because of that.
And you could do it that way like Tom did. Some organizations actually like to split them out. I prefer, I like what Tom did, and then kind of class out the different companies a little bit. But yeah, we can get really creative, if you do have, if it's common ownership, multiple companies.
That's great. And we mentioned, just real quick before we wrap up, the employee census a couple times. How personal does that census get, and is it anonymous? Are employees wary of filling that out? How does that work?
Great question. We really, you really don't even need their full names. I mean, you could drop a last name. I get, RA on it sometimes. It's that date of birth, the date of hire, how many hours they work in their zip code. So no, there's no addresses, there's no socials, there's nothing like that. This information isn't sold, to other companies, anything like that. And I'm really glad you brought that up, Kim, because it isn't that invasive at all. But the data is important to get the rates as accurate as possible. If you have someone who doesn't want to share with you their birth date, it's going to be tough, right? Because that's what the rating comes down to. But we really don't need much. If you want to look at disability and life insurance, because those are income supplements, we do need salary and job positions. But again, that's kind of that next step if you want to go there. I always, build the trust first, and then kind of go from there.
Well, that's great to go. That's not bad. They don't need to know about, if you're getting your 5 servings of vegetables a day or
none of that. Smoker, non-smoker, right. No, male, female, none of that stuff. It really just comes down to age.
When we started ours, we just pulled the data right out of our payroll system and gave them the generic data so we could get our quote before we even approached the employees to let them know this is what we were thinking. They're like, and so they didn't even know our employees' names or any of their details until literally September 15th for an October 1st start. So they knew their details 15 days before it started, but everything else was basically genericized data that we could just communicate back and forth so we can get an accurate quote.
And Jules actually from our team just wrote a little note. We have encrypted, emails and stuff. And so, this isn't just getting out on the intranet. We have really secure file feeds and stuff like that when we engage, we're not just sitting send on emails, and it's going through, secure sites.
Jules also asked me to remind everyone, and I'm glad she did that, in the chat box, I just repasted it in there, is a link to the handouts too. So if you want to go through that, as well as Reilly's contact information, should you want to chat more about health benefits or life or grass seed.
Right.
We are getting towards the end of our time here. Is there any final parting words from? Oh, let's start with Tom. I'm gonna put everyone on the spot.
Oh gosh, like I said, I think if you're interested in offering this, even if you're not going to implement it immediately, just check in and see what, when I got that quote back and I said, is that our monthly rate, our annual rate? And I was like, I can't, I was so surprised that I saved $2,400 on my plan alone per annum, just because I get a piggyback off of a 21-year-old that's working in my retail. And I'm like, let's do this. This is a no-brainer for me. I'm paying out of pocket $500+ in the health insurance exchange, or I can switch over here and get a similar plan for $200 less. It's like, it didn't make any sense not to try it. And again, if we would have looked at this before, we may have implemented it sooner, just because of that. We just went into it, both the owner, Stephen, and I worked in healthcare. We knew we were paying these ridiculous rates at the clinic, but it's because the majority of the staff are, licensed individuals in their 60s plus. So you'd be really surprised what the rates can be using a full demographic.
Yeah, that's great. And that's a good point. Like, why not just try it and see? Maybe you can afford it. Heidi, any party words for us?
I am just going to piggyback right off of Tom there, because I was shocked. And I do think that if we had looked into it sooner, we thought we couldn't even afford to offer it to our upper level management yet. And so when we got that real quote back, it just kind of blew our minds. And so I think it's just worth looking into, whether you're serious about it right in this moment or not. Having that information, I think, is really important as a business owner. And so you can sort of build it into your plan. If you do have any intention of offering your employees health insurance, which it's my personal belief that if we can, we all should, then you have some real numbers to go off of and some real goals to shoot for. And the people, if you don't know anyone, the people at CS Northwest, I know it's not an ad, but I would love to just sing their praises. They're so gracious and so great. And, there's no expectation of you have to sign up right now, or we have to get you on to a plan right now. Their mission really is to arm you with that information. So do it, just do it.
And I guess, yeah, thank you, Heidi. And what I'll say, I'm impressed that everyone lasted a whole hour with insurance talk. So thank you all, for taking the time. And, insurance it can kind of have that negative vibe. I'm sure you've all been sold something, tried to been sold insurance. And, we're in this kind of cool niche where we're consultants. We're not salespeople. And as a sativa consumer myself, I just want y'all's businesses to keep kicking butt. I love seeing everything, that's happening, in our market, in our state. So, reach out. There's no pressure. We're more than happy to run numbers and just keep that conversation going.
Awesome. Thanks so much, Reilly. Thanks so much, Jules and Jennifer, for watching. It's part of what the association does, is helping to set the standard for what it means to be a professional operator in this space. And for all of you out there who have already started this or are offering benefits, I'm proud of you, if I can say that. It's for doing the right thing and then acknowledging that you're doing it in an environment that's a little bit more challenging than every other state legal business. To take care of your employees means a lot. So yeah, well, with that, I'll stop talking because it's debate time. And then hopefully the next time we meet to talk about health benefits, maybe we'll see a little bit of change on the federal level, which will maybe help 280E and some of that banking issues. So we did record this. We'll send this out in a newsletter along with the slide information and Reilly's contact information if you want to chat more. Thanks again, Heidi and Tom. Thanks for being here. Thanks, Reilly.
You got it, everybody.
See you later.
Yeah, take care, everyone.